Yeah, that's true. So I'll just sit here and take some notes. Thank you.
All right, thank you for joining us. Well, we wanted this call to be short because I know that you all have a lot of things you're dealing with, but we did want to provide updates from several of our community partners that are really doing a lot of things in the community, but also have, you know, policies and things that have changed. I know every day things are changing, so we could have this conference call today and then, you know, next week it'll be a whole new world for us. So, you know, we just can deal with what we can deal with today and how things are going right now. We have touched base with all of our families in the 100 Family Program, or attempted to. And we do have some follow-ups. We've now heard from 43 families in the program, which is around 130 children or so, that are normally in crisis. So these are families that are normally in crisis in several areas, and we've asked them, you know, how things are going via this survey, and just going to give you a quick little update. And this was whether or not they worked during the day. This is before we had 43 participants respond to the survey, so this is a day ago or two, but the participants, the majority of them didn't work during the day, although you could see about 35% did. And so that's caused them some issues with the children being at home. And most of them have multiple children. Excuse me. So this question was about whether or not these parents had someone to watch their children during the day. And we had 25% say that they had people to watch, but it wasn't the ideal situation. 55% said they were not concerned about childcare. And then we had a smaller percentage, about 10% say that they will have to miss work, and 10% said it will be a cost burden to them. So, you know, childcare was one of the things we were concerned about. And I have touched base with DCFS about whether or not they had any an increase in hotline calls during this time, and they have not. And so far they haven't been. Of course, some of that has to do with the children are not necessarily being placed in they're not coming into contact with mandatory reporters either, so they, you know, may not have anyone to tell. So one of my things that I was most worried about is parents that are stressed, that typically do have recovery issues, or, you know, have past addiction or past mental health issues. Those parents under stress and hopelessness may return to their old lifestyle, or you know, become addicted to drugs again, or start using. And of course, also that increases the chances of child abuse and neglect. So those are definitely concerns for me. And so I've brought on Marla from the Guidance Center and Casey from Harbor House to kind of talk about what they're doing in their substance abuse and mental health programs, and what the changes are, because, you know, obviously they can't do business as usual, but people still need the support. So Marla, do you mind giving us an update on your recovery programs and co-occurring?
I do not at all. So what we're doing currently, I'll start with just in all this, the guidance center, the whole agency, because I know a lot don't just come for substance abuse treatment. We also serve for the mental health piece. So we have moved just yesterday. We are reaching out to clients and having most do telehealth unless they have no capability of doing that. They can still come into the office, but most are not wanting to come into the office. So we have moved to majority of our appointments to telehealth or telephone. The problem is we've been in conversations amongst other agencies as well. One of the restrictions is that family counseling is not covered by telehealth, and so is not allowed. And so we're trying to get that now, especially with schools being out, because we have a lot of children now that need family therapy, and we have no access to them without them being in school. So we're trying to get that to be a service that is allowable, because we know how many kids are court-ordered for family services. So we're trying to get that to happen. And they are still welcome to come into our clinics, but people are scared and don't want to come in. And so we're trying to work that piece out as well. Substance abuse services alone are still not covered through telehealth. And so we are able to do our co-occurring services through telehealth, but for just substance abuse alone, they still have to come into the clinic. We are doing walk-ins still every day, so anybody that needs an appointment can walk in any day, and we're still doing those. And those our original initiating appointment is done face-to-face still. That way we make contact with the client. As far as our in-home services, so like intensive family services, we are still making home visits because of just the concerns you just addressed. We feel like as long as we can go into the homes and feel safe going into the homes, and we've established a protocol with Children's Hospital, the same one they're doing in Pulaski County, and basically we're checking temperatures of families before we enter. We're making sure we have a questionnaire we're asking, but we feel like if we're not able to lay eyes on these families, we're concerned about what could possibly happen if nobody is checking on these families and they still need services. So IFS is still going on currently. Now that could change next week or in 2 weeks. We're also still doing Safe Care. So Safe Care is still making home visits as well. And then, of course, our therapeutic foster program, we're still doing home visits there as well. So all of those programs, all of our in-home services are still happening in homes. We have some therapists who are making home visits that are concerned about their kids that are not in school right now, that they feel like needs to have somebody lay eyes on their family. So there are still home services being done that way as well. But for the most part, we're trying to move to telehealth to keep everybody safe and to stop the spread of this virus.
Thank you, Marla.
You're welcome.
Casey, will you update us on what Harbor House is doing?
It sounds very similar to Marla, what we're doing here. I believe DHS probably reached out to them as soon as, this started coming around, and before the first case was in Arkansas with directives on that we needed to follow. In residential, we're not allowing any outside visitors, only essential staff. Upon coming to work, they are given a temperature and a questionnaire. And we're limiting our groups to less than 10 in the residential facility. Our regular co-occurring outpatient, we are doing visits, but opting telehealth if they would like to do that, and screening everyone as they come in the door. And they are doing face-to-face there. Here where we're in the ACC building, or anywhere in the state that's in the ACC building, there's no outside visitors at all besides staff allowed in the ACC building. So we are utilizing telehealth with our clients that are just as involved. Karen, you said earlier about people that's kind of on the ladder with substance use issues. A big thing is routine. And that's the concerning factor for me is that routine's getting, disturbed during this crisis that's going on. And, but my clients personally, they seem to be handling things pretty well, very resilient. But that's the thing that concerns me is that routine, losing that routine, because that's a big part of recovery. But that's all we have.
Casey, are you still, are your peer recovery coaches still going to homes, or how are y'all doing that?
No, they are not going in homes right now. No.
I also did talk to Sheriff of Fort Smith, Sebastian County, Sheriff Runyon, and he did say that the jail population has been reduced. So they went from about 370 to 320, and that was just letting out non-violent offenders that getting plea deals made, those kinds of things, getting people out on signature bonds and things like that, just as quick as possible in order to reduce their jail population. Of course, there's several reasons to do that, but one being, overcrowded jails would be a place where COVID-19 could escalate quickly, and hopefully we will not see a lot of increased criminal activity, but I did hear from Chief Baker that shoplifting is at an all-time high, and so is assault. So those are definitely concerning things, but I think shoplifting was already on the rise. I mean, Casey, you deal with that a lot in your alternative sentencing and things, but the main thing I've found is that if we can keep people feeling hopeful, if we can keep the stress down in homes, that's kind of the way I'm trying to look at how we deal with our families that were already in crisis, because right now we're probably not going to get a lot of people employed. We're not going to solve a lot of their long-term problems, but we can make sure that they're safe and feel hopeful and reduce some of their stress. And so we've asked them what their biggest fears are, and you can see on the screen, of course, the virus was a big fear, and a lot of parents were, what if I get it and I can't take care of my kids? Those were the comments I saw, and those are definitely valid concerns. As more people contract it, the kids aren't normally sick, I guess. That's what we're hearing across the world, is that children don't get as sick as the parents do. So that would be very difficult for parents to take care of their children. There was also, of course, money problems, not being able to work, childcare. We even had some concerned about teaching their children, which I thought that was, and we have reached out to that parent particularly to talk to her about ways to help with that. And so we began reaching out to the families that specifically said they had needs, like the food and diaper wipe shortage. Matt, you want to kind of update what you've been doing, and then also what our plan is in the future?
Yes, so we are trying, well, let me just start by saying, thankfully we have through our CityServe, which is an organization that brings in, I would say, leftover, overstocked items and lets us have a piece of those. The hub of that is in Little Rock. Little Rock is not sending anything out. Basically, they're depleted right now, but thankfully we had a reserve of wipes and diapers that we have had the opportunity, like yesterday, just dropping a box of diapers and some wipes off to a couple of our families who cannot buy, 2 weeks worth of diapers, their day to day or week to week. And so, or if they went to the store and tried to find diapers or the necessities just to live on a daily basis, most of those things were gone. So thankfully we have a stockpile of those. Obviously they'll run out. So we're just being very diligent with how we are giving those out. I'm trying to keep those for those that are in 100 families and with DCFS and just our partnership with them. And then also trying our best to, they're not, our families are don't have the ability that we have. Again, I say we, or just the middle-class family can go to the store and stockpile 2 weeks worth of food. It just doesn't happen for them. So Karen and I have been visiting. I've talked to the local church that are working to continue their food pantries and how we can be creative with that to have a drop-off service for those families. We're working through some paperwork today and hopefully to start that next week where we can be able to have the food bagged from local churches and then have those addresses and just be a drop-off service, not just basically drop the food, knock and leave, just so we can continue to practice safe health.
Mm-hmm. And let me tell you, they really appreciate it. I even had a picture sent to me with the giant box of diapers and the baby because they just wanted to say how thankful they are. And it just really more, just as much as the physical asset is the fact that someone cares about them. And so I want to continue to let our families know we care about them. Eddie Lee, are you on now?
Yes, I'm here.
Okay, you want to give an update as to what your agencies are doing?
Sure. So I appreciate everybody's response and reports today and all the great work that you guys are doing very, very much. At United Way, you've probably noticed we've launched the 211 call center this week. The timing wasn't optimal to launch, obviously during a crisis, but it's just the way it worked out. So anybody with a health and human service need can call 211, and we have 24-hour services with multiple languages interpreted. 365 days out of the year now, which is great. So it's just it's our resource guide on steroids. It's a nationwide program that's been in 48 states for a long time. Arkansas has just not had it. We've only had it in 4 counties in northwest Arkansas. So we were able to expand that call center here locally. I will tell you, with launching it during this crisis that we're all under, the call wait time has just been very, very long, and we're trying to add 12 more operators to that immediately, starting hopefully this evening, if not on Saturday. We're trying to communicate out the hotline number for the screening with the partnership between Baptist and Mercy Healthcare. They've done a great job collaborating to make that possible so people can call in, get screened over the phone. Then there will be an announcement forthcoming on, it may have already been announced this morning, but it's coming for a testing area. And we've got a press conference today at noon, and I'm sure that may be pushed out then. But in the meantime, we've just been communicating that information. Karen, on our website, if you go to unitedwayfortsmith.org, there's an immediate landing page. You can click on 211 COVID-19, and we have listed by county the different services that have been reported to us. We've reached out to all the mayors, and they're reporting back to us the services that are being offered inside the city. We've got all the websites listed for all the schools in our region, so if parents want to know about feeding. We're also working on a plan with our Boys and Girls Clubs and youth organizations to get out meal boxes to those families and children that would normally fall in the backpack program for the weekend. And we've been proactive with that, and we have some corporate donors that are stepping forward to try to help us to be able to purchase those items through the distributors that still have supplies remaining. Tankersley still has some good supplies, and so we're working on a plan to start implementing that just ASAP. Some of it will actually begin this weekend, but I'll have more information for you forthcoming. Another thing, Karen, we had a great meeting collaboration this week with our homeless organizations. There's been a lot of concern about the homeless population. They're very susceptible to the virus and also transmitters and carriers. So we met with the Hope Campus, Community Rescue, Salvation Army, and Next Step. Next Step has already gone outside with their tents and feeding opportunities on the church parking lot at St. John's, trying to do that social distancing and just get people out of the enclosed quarters. Chris is trying to ramp up services that he can provide. One of the great needs that we have right now is if a homeless person feels that they have been infected or have it, then getting them tested, and then how do they self-quarantine? So that's been a very difficult conversation this week, but we're working on space to make it available for them to self-quarantine so that they're not passing it on to other folks in the community and the homeless population. So a lot of moving parts in that area. And I could go on and on, but
Eddie
Karen,
Lee,
that's just kind of brief. Yes, go ahead.
This is Matt Pitch.
Hey, Matt.
I left a meeting with Mercy Hospital. We've been
Yes.
with their doctor's review team.
Yes, sir.
And there is real concern with pushing people out of the hospital back into nursing homes
Mm-hmm.
and them coming into the hospitals. And the homeless was a big discussion. And of course,
Yes.
their Mercy charities are trying desperately to get Salvation Army. Have you heard anything about Salvation Army and
Yeah.
or college dorms being
Well-
utilized for the COVID-19, but not the critical COVID-19?
As of yesterday, what was decided in our group meetings, and Carl Gefkin was there, Mercy was also present. Salvation Army, they're working to get approval from Oklahoma City to open up 15 beds for women, 15 beds for men. So that plan is on go. Should know something this morning, but that's only 30. So we were looking at an alternative site. We've looked at the old Regency Inn. We've looked at warehouses. We've looked at other opportunities, and we've run into just
Somebody
collapsing.
needs to talk to Cindy Crawford. Representative Cindy Crawford is working with her charity, and she's got a place that has a bunch of beds.
Okay, that's great. Well, we were told the Hannah House, Matt, we were told the Hannah House was not taking anybody at this moment, but I'll check with her again. And then
Well,
Chris
it's
is
the
trying to
Hannah
open.
House.
What's that?
It's not at the Hannah House. She has
Okay.
another building that could be utilized. So
Okay.
anyway.
And I'll tell you one step further. There was correspondence between Chris and Carl, where Chris is going to try to open up part of his 80,000 square foot warehouse.
Right.
So that's all I know at this point.
Okay.
But I'll
put
call
that on
Cindy
the-
and bring her in the loop and see what she's thinking.
I'm on here. This is Cindy Crawford.
Hey, Cindy. So just let me
Hey.
know what you need or how we can
All
help.
right. I am headed now to go talk to somebody, and I'll stay in touch. I have a couple ideas flowing in my head. I'm going to make sure it'll work for the homeless and for those that can't go back to the nursing home. So
Circle back with Carl and Chris to see where a lot of water's under the bridge on trying to resolve that. So circle back with them to just kind of see where they are. So, if
Okay,
that's
I
already
will.
been accomplished, you can put your resources towards something else.
Okay, I'll do it. Thank you.
Perfect. You bet.
Hi,
Thank you
Ed-
for everything.
Hey, Eddie Lee.
Yes.
This is Jeannie Carroll. How you doing?
Hey, Jeannie. How are you doing?
I'm doing well. Hey, listen, this is regarding the 211. Because, in these days, a lot of families don't have access to call. They have cell phones, but they can use it for texting.
That's
Yeah, the
Wi-Fi.
texting, the texting's up and running, and they can also go online to the web.
Okay, so they can text 211.
Yes. Yes.
Oh, yay. Okay.
We've
Thank
got to
you.
get this information out to people. I mean, obviously it is out because you're having long wait times on the calls, but I don't feel like a lot of our families know that 211 is able to be texted. So that's really interesting and good to know, and we'll get that out to them.
Yeah, so Karen, we're just trying to push it out to all the media outlets. We've sent press releases to all of our city officials and all of our places, and just trying to push that out through our website. And it's just a slow process, as you know, to try to just continue to move information, as we get it. But so thanks for passing that along to your clients. That would be very helpful.
Well, and another thing is, how it almost went viral, the incorrect information on Facebook about United Way's 800 number to call.
Yeah, it went viral in all 50 states. And matter of fact, up until about 10 o'clock last night, Miami, Florida, and Boca Raton, they were just jumping up and down and screaming out of those United Ways because people were still calling in to try to get their checks. And that originated in Indiana through a 211 service. And somebody just that received help put a meme together and sent it out just with good intentions, and it went nationwide, and it's affected the entire footprint of United Way worldwide. So, that's how contagious these little memes are, I guess.
Yeah, so we need to make a meme that has the accurate information is my point about
Well, if you'll go to our Facebook, Mitzi did post, and she's been sending it out. You can go there and just share that all you want. That would be very helpful.
All right, so next I would like to hear from Kara. Kara, you still on?
Yes, I am. So Mercy and Baptist, like Eddie Lee said, does have a hotline now. It's going to be manned from 8 to 8, Monday through Friday. So those who can't call during that time need to call Arkansas Department of Health. They have a 24-hour screening, so does UAMS. That number is going to have trained clinical staff screen you, ask you those questions that I'm sure many of you have already gotten asked, fever, cough, all of that. And then if they deem it necessary and you as a high risk, then they will set up an appointment for you to get tested. As everyone has heard in the news, testing is very limited. And not only is it limited, labs are getting backlogged because of all of this going on. So just please be patient. I've been told by multiple people, testing really is only high-risk patients, not everybody. Everybody does not have to be tested. So if you hear of a testing site, because I know there's other community clinics have announced they're going to do it Arkansas-wide, don't everybody go run out and get tested. Another thing Mercy is doing for the safety of our patients and coworkers is limiting the number of visitors, just like every other hospital in the state is doing. Right now, we're only allowing 1 visitor per patient. Now, let's say you were sick, you were in the hospital, 9 a.m., your husband was there, he had to go to work, your mom could then come. We just can't have 2 visitors at a time. Now, that does change for our pediatric and labor and delivery. We're not going to make the parent choose which one gets to be with the child. So the children do get 2 visitors. We are limiting the number of entrances. Our main hospital entrance is having screeners there from 6 a.m. to 7 p.m. Labor and delivery is the same. Our medical building, so that brownish building towards the center, is 6 a.m. to 5 p.m. And our emergency entrance is the only 24/7. So with all that being said, visitors have to be 16 years or older, fever-free and cough-free. This could change at any moment. So if you guys have any questions regarding visitor restrictions or any restrictions, go to mercy.net. There's a banner at the top for COVID-19, or Mercy Fort Smith on our Facebook page. That's the best way to get information for the hospital, because like you guys heard the governor say, and before the governor even said it, on Monday, we closed our fitness center. Our release of information has been closed to walk-ins. We're just trying to limit the amount of traffic that comes to the hospital and just make it essential people only right now.
Thank you, Kara. We sure appreciate all that you and all of you are basically frontline people. Our healthcare providers, our police force, our social service providers, our homeless providers that are here, and you are so important, but also I know putting yourself at risk a lot of times, and we just are praying for you constantly, and also for the families that are at home, and we're kind of under strife. We will continue to watch this. This was first week only. We find, people had normal levels of strife and stress for the most part. I asked them if there was a lot of bickering in their house. You have observed these families that have grown up, in kind of stressful family life, and how they sometimes bring that into their new families, and how difficult that can be whenever everyone's cooped up. So we just want to make sure that the families are operating, in a way that doesn't bring about abuse to children or neglect or any of that. So we will continue to monitor, is what I'm trying to say, and try to bring them some help and support so that they will continue to feel the community's care and not feel alone during this time. Paul, did you have any updates I know you have been following the governor very closely about some nonprofit assistance. Do you want to talk about that?
Yes, I put you can access the little chat window,
Okay.
and there's some information both on COVID-19, but also some other information for organizations that can apply for assistance. There will be several $1 million allotted in 2 different buckets to businesses and nonprofits through both loans and for grants. And so, you know, that'll be through the Department of Commerce has $4 million that they're going to allot out of their quick action closing funds. So those are state dollars. And then I believe there's a $12 million federal emergency grant that will be released. I put the link in here to a cut down version, an edited, shortened version of the press conference in which the governor announced that. And then there's a link there where if your organization or you have neighbors, friends, small business owners that are being impacted, they could just direct them there. And those resources are going to be made available here pretty quick.
Is there any way that could be emailed out?
Yes, can I send that to you, Karen, and can you send it to the group, to the invite group?
Yes. So everyone, check out your chat box as well, because Joni has posted something, and others of you that want to post onto that, just go ahead and do that, and then we can send those links out. Is there anyone on the line that wanted to give an update that has not been able to?
I can say for CRM, we still have 1 room left. If you have any families that are still looking for places, we are screening at entry, and they do have to call prior to coming. And we do have a very strict guideline once on the mission, unless leaving for work or an appointment with a doctor, you are required to stay at the mission.
Thank you, Heather. Anyone else?
Hey, Karen, this is Eddie Lee again. Kara, are you still on the line? Do we still have Kara? One of the things, Karen, that we're working on also is potential testing sites for the homeless. And Kara and Mercy Hospital is looking into the feasibility of having, after the screening process, perhaps having a testing location at the Hope campus or at St. John's parking lot, where Next Step is remoting out of. And I don't have word on that just yet. So if I do, I will get that back to you guys as well.
And also, as of right now, Sack Lunch is still feeding twice a day, and Next Step is feeding twice a day and they're closing their outside tents at 1 o'clock, just to give an update on that too.
All right. Anyone else?
Just real quick, Karen, if you guys have some information, I know you said you're going to share with what was shared today, but if anything you want us to push out to our groups in Western Arkansas, we have quite a network, so let's post it. And also just remember the Healthy Arkansas website and the 800 numbers as well for more information.
Okay.
Karen, this is Marla again. I didn't say earlier, but our crisis unit is still fully functioning. They're screening, of course, for temperatures and asking the questionnaires before admitting people. But other than that, the crisis unit is still up and running.
Marla, I met with Officer Taylor yesterday, the new crisis police officer.
Yes.
And so I appreciate the city's commitment to providing that service to our community. What have you had any interaction with them?
Yes, we're working with them really closely. We've done a few things to kind of help that team out. We have a sort of a telehealth platform that they can, if they have questions about somebody until they get fully trained, that they can telehealth in. They can just call in, and one of our providers can view the symptoms of a client to see, or of a Fort Smith resident to see, is this somebody who's able to come to the CSU or not. And that way it cuts down on their decision making. And then we're continuing to do quarterly CIT trainings. And so we just got finished. I think we were able to train another 27 law enforcement officers last month. So thankfully we got that in before all this coronavirus. So yeah, it's going good. We're working real closely with them.
I want everyone to have a chance to update, because I know this affects every single one of you, and you're all having to have policies and procedures in place, and things are changing so rapidly. So please update us if you have an update. All right. Well, we will continue. We will share the information from today to the network. I mean, I think it's so important that we make sure that accurate information is being given to the most at-risk populations and families that were already in crisis. We definitely want those families to continue to to be healthy, and of course children to feel loved and not traumatized through this. So it's really important that we keep in contact with these families and that we help them, even though we're all kind of having to feel the effects of isolation, but we need to show our community love and support. And I know that all of you are doing that, and you're just amazing, and we appreciate you so much. We will continue to have other calls as things change, because we know that's going to happen. So thank you for joining us for this short time, and we'll update you as soon as it's needed. Thank y'all.
Thanks all.
Thank you.
Thank you all.
Thanks.
You did good, Karen.